Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I am here with one of my best friends in the world, Dr. Mary Gardner. I love her to pieces. We went to vet school at Florida together. You'll hear us talk about that a little bit. She has a passion project that she is working on. It's around laryngeal paralysis and GOLP in senior pets. Some of you might remember Mary Gardner. She is the founder of Lap of Love Pet Hospice. She is a hospice care veterinarian. She is a amazing lecturer. If you ever get a chance to see her speak, you should. You're going to look and you're going to be like, man, she's doing 3 hours on end of life care. That sounds really down. It won't be. It will be riveting, and you will learn an absolute ton from someone who is super easy to relate to, someone who will make you laugh and smile and feel good about the work that we do. That's Mary Gardner. So anyway, she is amazing. I am thrilled to be talking to her about this project that she's fired up about. That honestly, when I first heard about it, I was like, why are we talking about that? Boy, she makes a good case. This is going to be great. Let's get into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Mary Gardner. Thanks for being back.
Hi, Andy. I know. I think this is like our third or something like that.
It's definitely up there. Like, you're definitely up there at the top of the people that I've had on the podcast again and again. It's just because I love you to pieces. And
I know.
We've known each other forever. And every time I talk to you, I get excited about what you're doing and kind of what you're excited about. And then we just kind of feed off of that. And so this was no exception. So you and I were together in Orlando in January, and I had looked at the program, and there was Mary Gardner is doing a LARPAR surgery lab. And I'm like, either that's a typo or Mary Gardner is blossoming late in her career in ways that I did not anticipate. And I talked to you, and you were like, I am doing the laryngeal paralysis workshop. And when I talked to you later, I was like, how was it? And you were like, I want 6 hours instead of 4. And I was like, we have to talk about this. Like, this is not, it would be like if I came to you and I was like, I'm into Turkish baking and I love it. And I'm like, talk to me about laryngeal paralysis and your love affair with this kind of odd medical condition.
It is. I know. And I always say, like, I love it, but it's weird to say that you love a disease, right? I hate it. I wish it wasn't a disease, but yeah. I love it. It's like, it's just something that came into my life personally and also professionally. So my Doberman, Duncan, he's always the topic of many conversations, but when he was about 9 or 10, more like 10, he started to clear his throat. So he just was doing it, which, I'm like, oh my God, that's my Doberman coughing. I instantly went to DCM, heart disease, and
yes. The dark place we go. Oh my God.
Right. He could have just had a little acid reflux. No. I went straight
heart disease.
Stage 20 heart disease. I already went there. So I bring him to the cardiologist. Like, I don't even touch my stethoscope. I'm like, you're going to the cardiologist, buddy, right?
They're like, no. It's when we turn into needy pet owners. We're like, oh my God, someone listen to this chest.
Exactly, because I can't. And so I brought him, and they're like, no, he's actually totally fine. And I'm like, he's doing this weird clear in his throat, and it's not a reverse sneeze. It's, And so turns out that then he was diagnosed with laryngeal paralysis. Okay. And this is probably, gosh, I should look at the exact dates, but it's probably around 2014, 2015 or something like that, right? And yeah, probably around that. And so it was then a decision. Do I wait for him to get worse and worse and then end up in an emergency situation, which is what we see so much? Mm-hmm. Or do I consider euthanasia before he gets that bad? And then, or do I consider doing the surgical option, which is the tieback? And for me, he wasn't so bad. Like, his breathing wasn't horrific. It started over the next few months. So I can then see his breathing when he was sleeping. It was, a little snoring, but it was like, and I'm like, okay. Nope, he's not going to live like that. Right. So no doubt in my mind, I was going for the tieback.
So this is a 10-year-old Doberman, right?
10-year-old Doberman. Okay. Yes. Okay. Yes.
So let's just be honest.
Very good point.
This is an old big dog.
This is an old man.
For a big dog, this is an old man. All right. I just wanted to flesh that out.
Totally. And I actually use this story in one of my lectures. And so I'm sort of doing parallel conversations here with you. So actually, years later, I was telling the same story to a group of veterinarians, and it was in Texas. And I didn't say it was my dog. I just said it was a 10-year-old Doberman. Who here would even discuss tieback surgery? And only 2 people in a room of 80 raised their hands. So I'm like, no, let me repeat that. Like, who here would just talk, like, give it as the option? And again, only 2 people. And I said, why not? And they said, he's an old dog and the risk of aspiration pneumonia is too high. And it just boggled my mind at that time that nobody would even consider it. And it was something that I had done. And then, of course, the reveal was it was my dog that I'm having this conversation about. So back to 2014, I absolutely did the tieback. And during post-surgery, he actually did have aspiration pneumonia because he vomited from like morphine or whatever they had given him. So this is again 2014. And so that is a risk, but he survived it and he was fine and he did great. Like he was fine. A year or 2 later, I started to see then this neuropathy happen in his back end. And I was doing, I was researching all of this. And that's when I learned more about GOLP than just LARPAR. And so he's the thing that started him having it is the reason why I love it so much, because it was such a big part of my life and treatment with him. He ended up dying of DCM years later. Oh. So he did get DCM, but that's why he passed.
How did you feel about that? Are you like heartbreak, or are you like, I called it really early. I was not off base when I had ago. I knew this was going to happen.
I know. It's one of the things you love a certain breed and you know what it comes with, right?
Yeah,
like,
I know.
So I know, but he was 13. So I got like almost 3 years after a tieback with him, where so many people it would have been a few months and then I would have had to euthanize him. So that's how it started.
Well, I love that you tell this story, and you and I have talked about this before with your work with Lap of Love, Pet Hospice, and things. And you and I we're both on the advisory board for the Gray Muzzle organization. This is a group that we both care about, and I'm glad that we get to do this stuff together. I saw this case, and it was dog had a splenic mass, and he's my neighbor's dog. His name is Copper, and he's like a 10 and a half year old sort of coon hound dog, not a small dog. And so I had that talk with him, you know what I mean? When you're like, well, there's probably 2/3 chance it's going to be malignant and 1/3 it's benign. And, this is kind of how it goes. And, kind of what do you want to do? And I guess I was kind of trying to cushion the blow, if they were going to say, well, you don't do it. And they were like, no, he's been a great dog. We're going to do this thing. And sure enough, it's benign. They take it out. That dog is stealing food from me at cookouts. Like, he sees me. He's like, that guy's a sucker. You know what I mean? And like, he tells you, but like, boy, you start thinking about it, you're like, a couple of years, sometimes I wrote an article about it and I called it, Sometimes It's Worth the Risk. And
yeah.
it's like,
That's a great.
Go with it. And sometimes it's just worth it. And
it's worth it.
I think it's easy to like write that off, and like I think we kind of guard ourselves by being a little dark or cynical. But man, sometimes it's totally worth it. Okay, so you go through this experience.
No, hold on that. I'm sorry to like. At what point is it not worth it? Right? Like, is it 6 months? Is it a year? Is it? If you think about chemo, how many times do we do chemo? And it's just to get a few months, or you amputate a dog with osteosarcoma. Like that's to relieve the pain, but you're not taking away his cancer. And so is that worth it? Right. And the one thing I just say while I'm just honest is no judgment, because there's not one right answer. No. So it's okay not to, but what I don't want to do is, everyone says old age is not a disease, but old age is not an excuse. And so like, it doesn't mean just because he was 10 that we shouldn't do it. Because if he had 6 great months of breathing okay, but then got hit by a car or something like that, I'd still be happy I did it. Yeah. So
I love that. I think that's an important point. I was just glad to see that. I love that you had a sort of happy outcome of saying he's 10. Well, that's why I sort of set up as a 10-year-old Doberman. And then you go, correct. Oh, well, we're going to do this thing. It's not a small undertaking. And then 3 more years, and it's that quality of life, quantity of life thing too, where it's not that he stayed alive for 3 years. It's that he could sleep. Good. Yeah, he could sleep and breathe, and like that's a significant difference. So anyway, so I love that. So you go have this experience.
Yes.
Right. So I'm looking at this. I know you're interested in quality of life. I know you're interested in seeing your pets. So you go through this experience yourself, and then talk to me a little bit about sort of the realization you sort of had, or sort of your experience around this, where you started to feel like this is something that needs more light on it, because that's kind of what I got from you at VMX when you were talking about doing this workshop and things. So help me get my head around like the need you saw in the larger profession, or what that kind of looks like.
Yeah, well, I think because with Lap of Love, and I go euthanize so many animals in their home, so many are because of mobility issues, and so many are middle-sized dogs, so 60, 70, 80-pound dogs. Like that's our bread and butter, let's say, right? It's mobility issues, large, medium, large dogs. And so many I go to, and now they're not in the emergency situation, right? Which what GP normally sees, is that the dog is under emergency. But here's a dog that has bilateral muscle atrophy. They've got weakness. It's clearly neurological on the back end. They're saying, he's kind of snoring more. He's having some breathing, struggling, and his bark has changed. And I'm like, this is freaking LARPar. Like, and I was just seeing it so much, but nobody ever talked to them about it.
Yeah.
And then again, at the same time, I had this lecture in Texas where everybody's like, it's too old of a dog. We wouldn't do it. And it was just like, but we can help so many, and the families want to do it. So it was probably in 2020, maybe I did a Facebook Live with this surgeon, Dr. Bryden Stanley, who is the godmother of GOLP. And we did it for it was an hour-long conversation. I asked her everything, meds, and thousands of people have watched it. Hundreds of people reach out to me, and these are pet owners, and they send me videos of their dog, and they're like, my vet doesn't know what it is, or they say don't do the risk, but I think I want to do the surgery. And I of course always walk a very fine line to never throw any vet under the bus, but I always say, go to a surgeon and get, here's the statistics, because now I know the statistics really well. And so it's just now my passion project to educate everybody in the veterinary field about it. And I love it. So, when we went to vet school, it was called idiopathic laryngeal paralysis. Mm-hmm. And we didn't know that actually there was a connection to the polyneuropathy. And this is where I think if a pet does even go for the tieback surgery, they need care with their veterinarian and rehab and stuff like that, because it's more than just a tieback. It's a whole big thing. And that's where GOLP. So that's geriatric onset laryngeal paralysis and polyneuropathy has come in. And so Dr. Stanley is the one who found that connection. Let's
go ahead and start to talk about GOLP a little bit here. Because when we started talking about the tieback and managing these cases, you do not fancy yourself a surgeon unless things have radically changed in our relationship. I was going to say, I was like, wow, you do a lot of things. You do a lot of interesting things. Surgery was not one of them that I had on my bingo card for you. But given that you're very interested in this topic, so talk to me about the interface here. So without making this into a surgery podcast.
Oh God, no, which it won't be.
Yeah, which is the blind leading the blind in that regard. Hey guys, I just want to talk to you real quick about the Uncharted Roadshow in Atlanta. I am going to be there with Stephanie Goss and Maria Parita and Tyler Grogan, and we are going to be doing the Uncharted Leadership Essentials Certificate. That is, it is 2 days. It is 14 hours of race CE. You heard that right. It is packed in there. It is workshop style CE. We will be doing Understanding the Trust Economy. We'll be doing strategic planning, vision and values. We'll be doing communication styles, feedback and coaching, achieving team buy-in, setting priorities, getting priorities done. That means holding people accountable and setting timelines and deadlines. We're going to be doing all of that stuff. You are going to be drinking from the fire hose, and it is all about you actually getting the skills. I said it is very, 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 very hands-on. You are not going to be sitting and get lectured at. You are going to learn. You are going to be a different and better leader when you leave than when you arrived. That is a Sunday and a Monday in May, as I said, the 5th and 6th in Atlanta. Grab yourself a spot. They are going to sell out. I would love to see you there. All right, let's get back into this episode. So talk to me a bit about GOLP. Talk to me about surgery as a tool. And if surgery is a tool, Mary, what are the other tools in the toolbox? What does this overall management of this condition look like in your mind when it's done exceptionally well?
Oh God, this is the most amazing question. Okay, so
thank you. I work hard. I take notes ahead of time. I prep.
I love it.
Things.
Prepping. So, well, actually, let's step back. I think about Duncan and his clearing of his throat, right? Everybody assumes that's like a tickle in his larynx or something like that. That was actually because he was having, regurg. So, like almost like acid reflux.
Yeah.
Because that comes oftentimes in parallel with GOLP, with the laryngeal paralysis. So basically, and this is definitely not surgery, definitely not an anatomy class here, but a laryngeal nerve actually is what the problem is with the larynx. But it's also all kind of connected to the esophagus. And so they will have esophageal mobility issues. And that's why they'll have little acid reflux. Some of them so much that they vomit often or regurg often. And so it's not just from the surgery or the tieback that they could have aspiration. It's because of their vomiting. Like that's why, because they may vomit or have that regurg, or they eat too fast and they have a tieback or drink too fast. But it's a risk factor even for dogs that don't have a tieback. And I don't think people understand that we have to actually help them with their regurg also, because it's gonna happen. And then what also happens is that they will get a polyneuropathy. So their back end is going to start to toe drag, get weak, all those things. So historically, when we at GP get a LARPAR case in, it's on emergency, right? So we are just hoping that they can breathe. We're not doing a full neurological exam, and half these dogs are like, basically unconscious anyway. We give them some ACE. So you're not doing a good neurological exam. So we never actually knew that the polyneuropathy was there. But many already started to have a little, CP deficits and things like that. So Dr. Bryden was actually doing research on the esophageal problem with LARPAR. So that's what she was studying. And when she had all these dogs coming in that were in her case, she was doing a full neurological exam. And she's like, wow, all these dogs this neuropathy in the back end. So it was because she was able to do a really good full exam is how she made this connection to it all. So really the optimal thing, if you've got a breathing disorder, is to do the tieback. And a problem is that it could be expensive for a family. There may not be a surgeon locally. There may not be a surgeon 8 hours from them, right? And so that's also an issue. It also may be an emergent situation where it could be something that we need to do in a day or two and not wait for 5 weeks to get to see the surgeon, the boarded surgeon. So all these things are happening, of course. So regardless of surgical intervention, you need to manage the esophageal problem, and you also need to manage that polyneuropathy. And it's no NSAIDs, it's nothing like that. It is physical therapy is the biggest help, and then environmental management and harnesses and stuff like that. So that, like in a high level nutshell, is GOLP. And with the surgery, so many people are nervous about recommending it because of the risk. However, the risk, here's the big thing, is that anesthesia for the surgery is very important. Technically, this isn't a difficult surgery on the pet. Right? You're not going into a spay is worse, right? It's a soft tissue. It's a tiny little incision. It's soft tissue. It's in the neck. It's 2 stitches. Close it, for the tieback. Then you got some skin, whatever sutures. An ice pack. It doesn't need morphine. It doesn't need all these things. This is why there was so much aspiration after surgeries, because we were over anesthetizing them. So that's why for this workshop I did at VMX, we had Sheila Robertson, our good, friend, talk about anesthesia, and it's only about 8% of a risk factor for aspiration pneumonia. And I always say it's 100% risk for asphyxiation. So I would much rather take an 8% risk than 100% risk.
Yeah.
And it might be a 14-year-old lab. Do you do it? Guess what? If you get 6 more months, it doesn't matter if they don't want to do it or they want to do it. But I don't think we should make that decision for our families. Yes. And I've done surveys of over 800 families, and about half and half did the tieback and didn't. And it's about 50% did not get the advice from their veterinarian about the tieback. They found it on their own. Yeah. And we absolutely should give the option for those families. But anyway, so that's where I get so kind of worked up on it, is because there are people that are not getting this information and they would do the tieback. Or then they need to learn about physical therapy and knowing how should your dog eat? Should it be a raised bowl or not? All these things.
Talk to me a little bit. I know we don't have a ton of time.
I know. Sorry.
But But I love it. If I was talking to a pet owner and I was like, hey, this is an option. This is what I'm seeing. This is kind of how it progresses. There is surgical intervention. We sort of gracefully talk about that and kind of, what does that look like for you? Is that something we want to explore a little bit? And they said, well, okay. So what is our life like after the surgery? Talk to me a little bit about, in sort of those terms, sort of at that high level, frame up for me what the commitment for physical therapy and the environmental management would look like. How much do you share with the pet owners kind of in the moment of what that looks like?
Yeah. What's funny is I think we recommend amputation of an osteosarc way more than we recommend a tieback, right?
Yeah, I think it's probably true.
Right? Yet you manage a Rottweiler, 100-pound Rottweiler that's just had his leg amputated. That's difficult. Like, that's a lot of care at home, where this is not so much. So there's, should we change the feeding and water habits? Yes, we need to slow them down. So there's slow water bowls. Should they feed raised bowls? Actually, not a raised bowl. They should be on an incline. So that way they're slow. That's how they should be fed, because it's gravity, right? Like all these things. It's not just a raised bowl. That doesn't do anything. We need to get them on an incline. And then, talk to the owner that probably the vast majority of pets will have a neuropathy, a start of a neuropathy, at least within a year from diagnosis. Duncan took a little longer because I think I noticed him sooner. I was like, well, that's a cough, right? Owners don't think I went a little crazy. So within a year, you're going to have a 60, 70-pound dog that may have trouble walking. And that means yoga mats around your house. Here's the help them up harness. Here's some physical therapy exercises. And it's probably about 18 to 2 years out that they live. But it's because we're already starting at 12. The average pet is getting it done at 12. So you're talking about labs that are probably going to die towards 14. Regardless, there's a million other things that they might be getting also. So I don't think, but the neuropathy does become a big issue. And I think it's very important to talk to owners, whether or not they do the tieback, because they may have a dog that has some respiratory issues, but it's okay. They're managing it well. They're in air conditioning. They're in a cold area. They don't, exert themselves. They're a couch potato. And, it's not that bad, but they're going to get the neuropathy also. And that's where it starts to be a caregiver burden. And it was I wouldn't say a burden. I would do it all day long for Duncan.
Sure.
And I can't tell you how many hundreds of people have emailed me about this. It's crazy.
Oh, I'm sure. I think that I'm trying to think back to where my sort of ideas around this procedure come from. I feel like, and you were there, we were there together in the same class, but I feel like the whole aspiration pneumonia was beaten pretty soundly into me. I don't know if it was, I think it was one of those things where, like, if I saw a test question that had laryngeal tieback, the question was going to be, or the answer was going to be aspiration pneumonia. You know what I mean? Like it was that. It was
30% risk then. But that's because of like the anesthesia that they're doing back then, right? So we could do it so much better, so much more simple. We don't need massive pain. They don't need to be on morphine. It's not that bad, right? So it's better to have them alert and not, all drugged up. So I think you're right. That was 100% when me and you were in that. That's what we were taught.
Well, I was trying to remember why I had that thought, because I'll be honest, like, it's not a procedure that's really kind of been on my radar. I haven't looked at a dog that's struggling and been like, well, I'm not going to say anything, but I'm like, why didn't this come to my hand faster? As I think that when we were going through it, the risk really was taught as being quite high. And I was like, boy, this is kind of a last resort, is how I had it filed in my mind. I think I'm glad you're talking about this. I know you and I had talked earlier, and you said that you're going pretty hard on this. You're putting together, talk to me about the website that you're sort of putting together. You sort of mentioned that you were sort of putting together resources and you wanted to make this really accessible. What's your plan with that?
It is just my passion plan. So it's been totally self-funded. It's called All About GOLP. So all about GOLPP.com. And it's for both the pet parents and the veterinarians out there. So I wanted it to be like a one-stop shop of education for the pet owners. So what is it? What are risk factors? Medications, because there's doxepin discussion, like, should we use that? And no, don't waste your time on that. Things like that. I've also got a veterinary section. So it's got how to diagnose, what are the signs, surgical, non-surgical options. And then there's a whole set of resources. So there's handouts for veterinarians. We've got history handout. We've got an oral exam handout for them. We've got client education handouts, all free on the website. And then the biggest thing is just these rehab videos that I made with Dr. Carolina Medina, if you remember her from UF and the acupuncture service. And so we made about 11 different rehab videos for just exercises at home that aren't a big struggle for dogs. It's not like go run agility. This is, the cookie stretch and the incline stand and, stuff like that. So it's got all the resources and lists of the boarded veterinarians out there, the list of the rehab facilities. And yeah, so it's just, my goal is that it's the one-stop shop for people to get educated on both pets and vets, both pet owners and vets.
It's funny. As I've come along in my life, I have come to really appreciate stories and examples that illustrate who people are. And so I always think it's this beautiful thing if you can reach into your pocket and kind of pull out a story or an example about someone who sort of encapsulates who they are. And one of my favorite stories about you is this one, where it's like you're the person who gets excited about something that they care about, and you don't post it on Facebook. Like you're like, nope. You launch an empire and crusade, and you're building. There's going to be a GOLP app that you're gonna have.
Yes.
I mean, yeah,
I would love that. Yes.
I see you running across a professional sporting event with like a banner behind you before security tackles you that says, ask your vet about GOLP. I mean, it's just you.
I like that.
You get these passion projects and you go with them and you do such great stuff. And I don't think you get enough credit for all the work that you do for the profession. But anyway, I love you, buddy. I'm so glad that you do this. And I really appreciate you coming and sharing with us. So cool. Mary Gardner, besides the website and all the resources, where can people find you online if they want to follow your adventures? Where can they find you?
So my personal adventures are at Dr. Mary Gardner, so Dr. Mary Gardner, and I'm on Instagram and Facebook, and my shenanigans are out there, and I will post about this in a couple of weeks when I'm ready to, but it's been fun. So you can follow me there.
Very nice. Cool. Take care, everybody. We'll talk to you later.
Bye.
And that's what I got, guys. That's my talk with Mary Gardner. Thank you to her for being here. Thank you to you for also being here. Thank you to me for I'm here as well. Like we all need praise sometimes. Like we all want to feel appreciated. And so I'm appreciating myself. Anyway, guys, if you enjoyed the podcast, send it to your friends. If you're like, I don't have any friends to send it to, but I really liked it, you can just go and leave me an honest review wherever you get your podcast. That's super helpful as well. Anyway, that's enough. That's enough of this. Let me let you go so you can get out there and do good in the world. All right, I'll see you guys soon. Bye.